Hello, my name is Ijoma Alozie, and this is my Sleep and Dreams Outreach Project. So first we're going to discuss sleep cycle basics, and then we're going to move on and discuss sleep debt. Next, we're going to look at common sleep disorders, where I highlight two of the most common sleep disorders and go more into depth with them. Next, we're going to talk about what affects sleep quality, and finally, we're going to end on misconceptions about sleep. So before we dive in, what is sleep? Sleep is a natural restorative physiological process that requires perceptual disengagement and must be rapidly reversible. It involves mechanisms of learning, memory, and synaptic plasticity, and the need for sleep is biological, but the way you sleep is learned. So, sleep is impacted by homeostatic and circadian factors, and the stages of sleep are awake, N1, and REM, which stands for rapid eye movement, N2, and N3. The difference between these three can be seen in EEG, showing the different brain waves that occur when in these different stages. So the awake stage has alpha waves, the N1 and REM stage have theta waves, the N2 stage has sleep spindles and K complex, and N3 has delta waves. So the less sleep we get, the more of it we need, which ties into sleep debt, which is on the next slide. And alertness and sleepiness levels peak twice a day each. So in our class, drowsiness is red alert is a very common phrase. This phrase is supposed to highlight the dangers of drowsiness and sleep debt. Sleep debt occurs when one does not get enough sleep and is cumulative. So if you need 8 hours of sleep every night and you only slept 6 hours one night and 7 hours the next night, you've already accrued a sleep debt of 3 hours. So this lack of sleep results in an inability to carry out tasks, inattentiveness, and increased danger of carrying out certain tasks like driving or flying or playing sports. Some common sleep disorders are insomnia, obstructive sleep apnea, restless leg syndrome, sleep paralysis, and narcolepsy. For the sake of time, I can't go into depth of all of these sleep disorders, but I will focus on insomnia and narcolepsy. So insomnia is characterized by having trouble falling asleep or staying asleep that results in some daytime impairment. It is a symptom, but it can become a disorder. There are three subtypes. The first is chronic insomnia, where symptoms occur at least 3 times a week and stay for about 3 months or more. Short-term insomnia, which is also referred to as acute or adjustment insomnia, which any of us can suffer from at any point in time. This could be due to factors such as stress. And the third type is other insomnia disorder, which is when it doesn't fit into these first two categories. About 12 to 15% of people have chronic insomnia, and insomniacs miss about 2 times as much work as non-insomniacs. Now, this can lead to other conditions as well, such as depression, generalized anxiety disorder, coronary artery disease, and more. Next, we'll discuss narcolepsy, which is a chronic neurological syndrome. Half of the people that suffer from narcolepsy have onset before the age of 15. With narcolepsy, there is a loss of about 70,000 lateral hypothalamic hypocretin, also known as orexin neurons. When someone suffers from narcolepsy, they deal with the mixing up of the dreaming brain with the sleeping and awake states. Symptoms of narcolepsy include cataplexy, which is the sudden loss of muscle tone when dealing with intense emotions, hypnagogic or hypnopompic hallucinations, excessive daytime sleepiness, sleep paralysis, sleep attacks. And to remember these symptoms, just remember the phrase chess. So our bodies run on an internal clock that impacts our sleep quality. So why do our bodies run on an internal clock? Because we are anticipating environmental changes or other organism behavior. There's also internal synchrony. So light and circadian rhythm can impact sleep quality, or light can impact sleep quality because of the circadian rhythm. The way light can impact sleep quality is based on the time of day light is seen, the intensity, how long someone is exposed to light, and the wavelength composition, aka the color. Travel can also impact sleep quality. So things like jet lag impact sleep quality, and westward to eastward travel is worse for sleep quality. So a way to combat this is to practice good sleep hygiene. This involves avoiding naps during the day or avoiding ingesting stimulants right before bedtime. Also, exercise promotes good sleep. Avoid eating right before bed because that can impact your sleep quality, and have a consistent and relaxing nighttime routine, which can also help with sleep hygiene. Finally, avoid working in your bed. This is also known as associating your bed with sleep. Some common misconceptions revolving around sleep are that people fall asleep in class because they're bored. This is not true. Monotony and mass sleepiness, but it does not cause it. If you're falling asleep in class, it's probably because you have sleep debt. Watching TV before bed helps. While this might seem relaxing, the blue light, as we mentioned before, can mess with your circadian rhythm. Finally, the snooze button is good for you or helpful. Actually using the button is more harmful in the long term because it messes with sleep cycles. For example, if you're ending a night of sleep, you've already gone through REM sleep and you've gone through all your sleep cycles, then you wake up and then you press your alarm and you fall back asleep. You're re-entering the sleep cycles, but snooze buttons only last about 8 to 10 minutes. And then when it wakes you up at the end of the snooze button, it's interrupting you in the middle of the sleep cycle, so you end up feeling more tired. Thank you so much for listening to my presentation and have a lovely day.